We're just going to give it a couple of seconds and then get started. Okay, hi everyone. Welcome to another 2025 ALS Canada webinar. My name is Umianga Yogalingam, and I am the Manager of Knowledge Exchange and Community Information at ALS Canada. I will be taking over hosting duties today for Emily. Thank you all so much for joining the webinar today. The focus is on driving and ALS. Now, before I turn it over to our speakers, a couple of housekeeping items. So please feel free to drop your questions in the Q&A or the chat section. We will aim to answer all the questions at the end of the presentation. If there are questions that we have not answered, you can always email us at communityservices@als.ca. We can answer them or get you the right resources. And I will put the email in the chat at the end. There will also be a link to a survey at the end of the webinar, just to give you a chance to provide your feedback. And again, I will put more information about the survey at the end of the webinar. Oh, sorry, one second. So now, without further ado, we're pleased to be joined by Brianna Marbach and Murray Mitri, who are both occupational therapists from Sunnybrook Health Sciences Center. Thank you both so much for being here. And without further ado, I'll pass it off to you.
Thank you so much. Thank you. So we are happy to be here today chatting with everyone who's joining the webinar about driving and ALS. This is something that both of us talk about a lot here at the Sunnybrook Clinic. And it's something we felt was important, and in conversations with ALS Canada that we know you guys are having conversations with community leads about this as well. So thank you for having us and for giving us a chance to chat. So we've tried to make today as informal and interesting as driving and legislation can be. So we've structured it based with a lot of questions that we get asked on a regular basis, trying to get ahead of some of the big questions that we think you likely have if you were interested enough to join the webinar today. And then there will be time for your questions at the end. So definitely, please, if we don't touch on something that's really important to you in this area, please bring it up. So we're going to be talking about who we are, why we're talking about driving at all to begin with, what the law says about driving, how ALS can impact someone's fitness to drive and the consequences of driving at risk, how fitness to drive is assessed, what to do if you disagree with your doctor's assessment about your fitness to drive, information about vehicle adaptations that can help to extend the time someone spends driving, what to do if your license is reported, and just sort of some general ideas about what to do to prepare for changes in fitness to drive that may happen over time. So we'll start with the easy part. So I'm Brianna. I'm one of the two OTs at the Sunnybrook ALS Clinic. So we are a full allied health neurology clinic at Sunnybrook in Toronto. I've been here since 2018, so it's been about 8 years now. And in that time, I've followed about 1,500 people with ALS. The other thing that I like to bring up when I'm doing these conversations is that I was also a family caregiver for someone with neurodegenerative disease. So while today I'm talking from my experience as a healthcare provider, I do recognize that there's a flip side to these conversations and that none of what we're talking about is easy, that none of it is without emotional weight. And I've been on the other side of the exam room as well. So I just like for you to know that I understand that side of things too.
Hi, everyone. My name is Murray. I have been with the Sunnybrook Clinic for about a year now. And previous to that, I've worked in multiple settings listed on the slide. And most importantly for this presentation, I did work in motor vehicle accidents as an OT for about 3.5 years before coming on to Sunnybrook.
We do also want to give a big disclaimer heading into this that we are practicing in Ontario, and that is where a lot of our information is pulled from. That doesn't mean it's not applicable to other provinces, but we do want to just give the heads up that any of the nitty-gritty things we say about law or processes or costs that you run that by your clinic or your neurologist or your family doctor just to get up-to-date information in your province as well if you're listening from a different province. I have summarized here the different roles of a physician across the provinces. So in every province and territory in Canada, a physician does have the responsibility to discuss fitness to drive with their patients. There's just some nuance around whether they are a discretionary reporter, which is true in Alberta, Nova Scotia, and Quebec, or a mandatory reporter, which is true in the other provinces and territories. So, right at the very beginning, why are we talking about driving? Why did we think this was worthy of a webinar? The biggest reason is that driving is important, and that's something we recognize, and it's something we hear from people every time we have these conversations. From an OT perspective, we call driving an instrumental activity of daily living, which means it's about one step over from the basic things you do every day, like getting dressed, brushing your teeth, having a shower. There's another set of activities that come right after those in terms of importance, things like going to the bank, buying food, and driving. So they are second only to those basic and essential activities of daily living, and we recognize that that's a central part of people's lives. We also know that driving is more than just getting from point A to point B in a car. We know that the act of driving lets people stay independent. It gives you community mobility. So that's things like being able to access healthcare, being able to access your job, being able to access food, and being able to meet with other people, whether that's through religious events, just going to a friend's house, being able to be with the people that are important to you. We also recognize that can look really different in different areas of the country. So obviously here in Toronto, there's a lot of options for getting around, but more rurally, we recognize that it's a very car-centric way of life. We also know that driving is something that isn't just something we do, it's actually something that people see as part of who they are as well. So driving does form part of our social identity. And when they do the research, they actually notice that people are quick to identify as either a driver or a non-driver, depending on their role in life. And then lastly, we hear all the time that driving is a huge part of people's quality of life. And a quote that I could ascribe to a number of different people that I've spoken to, but something that comes up over and over again in clinic, is people telling me that I feel most like myself, like I'm healthy again when I'm driving. And when we hear that messaging, again, we take it seriously. We are both drivers. I grew up rurally. We understand how important it is. So please know, in the whole context of this conversation, we never want it to seem like we are undercutting the importance of driving in your life. We also know as OTs that driving is complicated, especially if you've been driving since you were 15 or 16 years old, or maybe earlier if you were on a farm. It may seem like second nature, but when we actually break down what driving looks like, you are using all sorts of skills every second you're behind the wheel. Some of those, I've tried to summarize it on this slide, but it gets very nuanced very fast. Just paying constant attention, right? At no point when you're driving can you really take a break. You're constantly paying attention to what's going on around you. You're doing a lot of cognitive processing, being able to remember what's been happening, shifting your attention from one thing to another, inhibiting distraction. You also have motor skills that need to be right on point for everything you're doing. So your reaction time, your strength, your range of motion. And that's just you as the driver. Then there's everything happening around you in the environment. That could be the road layout. Is there a new roundabout where there's always been an intersection? What's happening with merging on and off of the highway? Where is construction happening? There's weather conditions. We all know that driving in wet snow is completely different than driving on a sunny day. Time of day you're driving, is it rush hour? Around here, when isn't it rush hour? All of those pieces, they can impact what your driving looks like. And also where you're driving. As we mentioned, there's a completely different set of skills for driving on the 401 versus driving on a back road in a snowstorm. And it's, as a driver, you need to be able to do both. Driver performance has to do more with the skill of driving itself. So that's things like being able to respond to the unexpected. So your skill as a driver at responding when someone cuts you off unexpectedly, driving the speed limit, or being able to drive safely at different speeds, and the following distance that you leave behind other cars. And then, and this is something that I actually found interesting when I was researching this, they pointed out that lately, Drivers are also information managers, where you're having to take in all of this information from your car and modify that in your head as you're driving. Whether it's the GPS talking to you, the radio, different alerts or alarms going off, cruise control, all of these information management pieces are also things that you're having to think about and interact with while you're driving. So driving is complicated. That's the other reason we're talking about it. The third reason we're talking about driving is that driving is dangerous. So it is the most dangerous thing we do on a daily basis. Globally, road traffic crashes cause nearly 1.2 million preventable deaths and an estimated 50 million injuries each year worldwide. That's a big deal. And I think we all have an awareness that driving is something that comes with risk. When we look at whose responsibility safety on the road is, it's a shared responsibility. So government plays a role in the laws that they set and the processes they follow. Automobile manufacturers are responsible for making their vehicles safe. Medical professionals are responsible for, looking at how people are presenting in clinic and making sure that they continue to be fit to operate a motor vehicle. And individual drivers are also responsible for safety on the road. The driver's handbook, which I went back to this week, actually goes as far as to say that everyone is responsible for avoiding collisions. Even if someone else does something wrong, you may be found responsible for a collision if you could have done something to avoid it. So when I think about that as a driver, I think about the fact that I don't drive if I take a full dose of my allergy medication. There's things that we all do that every time we get into a vehicle, as drivers, we're thinking about whether or not we're safe to drive that day. And that's an ongoing responsibility that all of us have. And lastly, we're having this conversation because we don't want to surprise you. Driving is a conversation that comes up often here at clinic, and we know it's a source of worry for people living with ALS and their families. We also know we haven't been doing a good job of this historically, and we've gotten some feedback that I really appreciate, and if anyone on the call has given us that feedback, thank you, that we haven't been having this conversation as well as we should have been. So it's something that here at Sunnybrook, we're really taking a look at right now and working on our approach and trying to improve it. And so this conversation is part of that. We also, when we look at the Canadian Medical Association's Guide to Driving, it's very clear that in diagnoses like ALS, driving needs to be discussed early in the course of progressive conditions before it becomes a problem. So that conversation about driving here at Sunnybrook especially is something that we're going to start having early so that the conversation isn't a surprise and that you're fully aware of what we're talking about right from the beginning. We don't want to blindside you.
Okay, what does the law say? Once again, I know we mentioned at the beginning, this is taken from the Ontario laws, although all the provinces have similar laws, there might just be different wording, but they are quite similar. So in Ontario, we have the Highway Traffic Act, which encompasses pretty much everything to do with driving and managing a car. And the first line of the Highway Traffic Act is that driving is a privilege. Here, highway means like any type of street, avenue, parkway, driveway, whatever. And the privilege is granted to and retained by people who can demonstrate that they are likely to drive safely. So that's already like the first line is you need to be able to drive safely and that it's a privilege. One of the other main things about the law is who can report licenses, so that a medical doctor, nurse practitioner, and optometrist have a mandatory duty to report. That means that if they see something or they're unsure of how safe you are to drive, they have to report by law. And then added to that is occupational therapists are also mentioned as discretionary reporters, which means if we see something that's unsafe, we're not mandated by law to report, but we are able to report. And then in Ontario, the G license is all or nothing. You can't be downgraded to a G2 or a G1. Like you either have your license or you don't have your license. And there's no place on the form or no legal basis to kind of pick and choose. Like it's just doesn't exist. And then finally, you can't, this is gonna sound really self-explanatory, but you can't drive with a suspended license. And you also can't drive in Ontario with a license from a different jurisdiction that's been suspended. So if you're from Alberta or BC or Quebec and your license was suspended, you can't drive with that license in Ontario. And for any of our patients or clients who are supervising maybe younger drivers or new drivers, if your license is suspended, you cannot supervise G1 drivers either. Here's also medical conditions that could be reported. I put all of the ones that were listed, although they might not necessarily be applicable. Cognitive impairment, so that's how your brain is thinking, attention, judgment, problem solving, switching between tasks, things like that, which we'll go into a little bit more detail later. If any of that is impaired, your license can be reported. Sudden incapacitation usually has to do with seizures, so anything that you can just like black out or just not be aware of your surroundings. Motor sensory impairment is the kind of the main one with ALS, so that's, you know, if you've got weakness, leg weakness, if you have spasticity, so you're too stiff to move, if you're not flexible enough to move your neck, arms, legs, that can also be reported. Visual impairment, self-explanatory. Substance use disorder if uncontrolled or non-compliant with treatment recommendations. And finally, psychiatric illness, but only when it affects your perception or if there's an intent to harm yourself or others. Okay, insurance law. I did spend a few years working with motor vehicle accidents. I have had to go through the insurance law multiple times because adjusters like to cite it a lot. So I needed it to appeal. The insurance companies will only reimburse for medical benefits or impairments caused by the accident. That means that if you are getting weaker or more fatigued or any other sort of condition from maybe stemming from ALS, but not from the accident, they will not pay out for that. It has to be something stemming from the accident. You can't claim insurance if you're driving without a valid license. You do have to tell your insurance company if something changes in your life that may impact your driving. That's really important. And then finally, there's a whole separate law about how illegal it is to drive without a valid insurance. Everybody needs to have insurance on the road, no matter who you are. Oh, I'm sorry. What are the potential consequences of driving at risk? So the main one is, the big one is health. This is probably the one that we think of when we say driving is dangerous. These stats are from Ontario in 2021. The fatalities were 561 in total. Drivers were the majority, but passengers were also killed. So it's not just you driving in the car and maybe the other car, it might be a loved one who's in the car with you. And then I also added the pedestrian statistic because it shows that this isn't just highways, it's not just driving fast and things like that. It's in neighborhoods, smaller streets, rural areas, like pedestrians are also getting hit and killed. In this statistic, major injuries mean anything that required surgery or hospitalization. Again, you can see the numbers, like drivers were the majority, but then passengers and pedestrians, those numbers went up quite a bit. And then finally, minor injuries are things that people went to maybe the emergency department for, but weren't admitted, so they were sent home. And like now it jumps up to 16,000. So, and keep in mind the minor injuries like whiplash, back pain and things like that, that's something that can follow you the rest of your life or the rest of your loved one or who else was involved in the accident. It doesn't have to be a huge injury for it to impact your life. And then I kind of, just to, I guess, make more of a point with more numbers, this is also from 2021. It highlights a minimal in this case as you didn't go to the hospital at all, none is no injury. But it just kind of highlights pedestrians, bicycles, everything. Everybody's impacted by this. Okay, and then health. I wanted to add this stat as well. Collisions where the driver had a medical or physical disability. There was about 1,000 in 2021. It caused 15 fatalities and 493 personal injuries. So that encompasses the major, minor, minimal. But that's quite a bit for 1 year for one specific category. Nothing. So it's really important that we go over it. And then there's a lot of financial consequences. Like, don't forget, like if you're driving the car, your car could get demolished, which is total loss. Severe in this case, which is still quite a bit. It's about 36,000, 25,000, sorry. No, 36,000. That's like the car can't be driven without it being repaired, right? That's a lot. And cars are expensive, as you know, so it's quite a bit of money. Moderate are they need repairs to drive safely. Light is little damages like scratches, bumps, things like that. You can drive the car, it's fine. And then none was only 8,000. So even if the injuries were minimal or none, the financial consequences are quite a bit. Okay, and finally, if there's a collision, I'm gonna walk you through what happens. As the treating OT for motor vehicle accidents, I witnessed this firsthand and was usually a part of it. So your insurance company, if you get into a collision, will most likely do their own physical, cognitive, and psychological assessment. These assessments take hours. They're meant to find out exactly what was caused by the accident and what injuries or anything coming out of it was the ALS. If it was caused by the accident, they'll pay out, it's fine. If not, they'll do their best to blame the ALS, right? Like if you say, oh, I can't move my hand anymore, well, how do we know that's not ALS, right? So they're going to try their best not to pay out. Keep in mind, adjusters and lawyers are not medical professionals, so they rely on experts and what's written. They will ask for your medical records and have their own experts review as well. And like I said, this will inform how much they reimburse because they're trying to decide what's the ALS and what's from the collision. And your monthly insurance payments will increase. I'm sure everybody knows that. And then the other insurance company. So if you hit another car or another driver hits you and you're not at fault, this whole process will still happen, even if you're determined to be not at fault. The other party's insurance company will ask for medical records and assessments for the same reason yours did, to determine, what could the accident have been avoided, even if you're not at fault, if you didn't have an impairment. And then this will inform the amount included in the final settlement. So financially, you could be impacted quite a bit, and your insurance will be impacted as well. And keep in mind, these cases go on for 2 to 5 years. So it's not a quick in and out, couple months here and there. It gets dragged out quite a bit.
So then we need to talk a little bit about how ALS specifically can impact fitness to drive. So again, the most clear-cut symptoms are the physical ones that can impact your fitness to drive. Grip strength is one of the ones we look at for holding the steering wheel. Arm strength for turning the steering wheel and reaching all the required levers, gear shifts, mirrors, and controls that you might need to reach at any time. One of the important pieces is that we're not just looking at how well you can drive a car straight on a straight road with no stoplights. We need to be confident that you can operate the vehicle in a variety of situations, including swerving out of the way of a kid chasing a ball onto the street, including being able to turn very sharply at a slow speed in a parking lot to avoid someone else. All of those things that are unexpected and sudden need to be considered as well. We look at your neck strength for shoulder checks. We look at the use of your right leg for gas and brake pedals, and the left leg for clutch if you're driving a manual car. As Marie mentioned, we're not just looking at weakness, we're also looking at muscle tightness. So if you have spasticity and it's slowing your reaction time, that's also an important physical factor for us to consider. And lastly, we also look at your breathing. Our respiratory therapists are always telling us breathing is important, and it's true, right? But for driving, being able to maintain your alertness and consciousness, getting a good night's sleep, all of these pieces are linked to breathing and are really important for safety when driving. We also know that in some cases, ALS can impact cognition. As we discussed, driving does use a lot of cognitive skills. So this is still something we also need to consider. It's tricky with cognition and driving because when you're performing those familiar tasks, even people with moderate cognitive change can still perform well on those skills. But the problems show up when people have to start facing complex problem solving, unexpected changes to their plans, or wayfinding. So it's a tricky one because there may not be evidence when you're watching someone drive who has cognitive change, but if we're seeing evidence of cognitive change elsewhere, it may still be enough of an indication to impact someone's license. It's also difficult because people with cognitive change may not always recognize their deficits or have that insight into how they're doing. And unfortunately, we're going to talk later about all the different ways we can improve safety of vehicles for physical difficulty with operating controls, but there are no adaptive devices for cognitive limitations at this point. I also wanted to highlight separately the role of fatigue in driving. So fatigue is, I think, the most common and debilitating symptom of ALS based in the research. We also know that fatigue, whether it's mental or physical, impacts anyone's ability to safely operate a vehicle. There's all sorts of research on shift work, long-haul trucking, that kind of thing, and the impact that fatigue has on safety in those populations, to the point that it's known to be a factor in 10 to 40% of crashes worldwide. And that's the ones that are known, not the ones where that's not even admitted into evidence for it. And the reason behind this is that fatigue can impact all sorts of function, your attention, your memory, your decision-making, your response time, and your ability to physically control your vehicle. So this is one, we don't have a measurement for fatigue in clinic, but if you are starting to be incredibly tired with your normal activities of daily living, it's a good self-reflection one to wonder whether or not you feel good about getting behind the wheel if you're experiencing severe fatigue. The other one that falls into that category is your mobility in general. We will not make a decision about your license based on the mobility aid that you are using. People are able to operate vehicles using all sorts of mobility devices. However, as your OTs who care about you outside of the vehicle as well, we may ask questions about your community mobility when we're concerned about things like you getting in and out of a vehicle safely, or you being able to get your mobility devices in and out of a vehicle safely. If we're worried about your ability to get a rollator or walker in and out of your back seat, we may start to talk to you about driving cessation, not because you can't use the vehicle, but because we want you to be safe doing whatever it is that you're doing in the community, and it may make sense to have someone else with you to support you with that. So I've looked at this a little bit in the last part, but I do want to talk specifically about how we assess fitness to drive as well. The biggest piece with this, and it's a bit of a nuance from a language perspective, is that there's something called a driving screen, and then there's something called a driving assessment. And they sound like they're the same thing, but they're not. In Ontario, and in general with the research, right now, the only gold standard to evaluate someone's fitness to drive is an on-road test. They're looking at driving simulators, they're looking at pen and paper tests, they're looking at physical screens, but nothing has been validated to the same degree as an on-road test at this point in time. Ideally, that means we would have everyone doing on-road tests whenever we want it. Unfortunately, in Ontario, those tests can cost $400 to $800, and there is no funding available for them. And that's something that we take seriously. And so because we don't want to send you to go pay $800 over and over again to do these gold standard assessments, we use in-clinic screens to identify people who fall into 3 categories. The first category is people where we do not have any current concern about their safety operating a motor vehicle right now. The second category is people where we're uncertain about their ability to operate a motor vehicle. If you remember the law that Murray talked about, that's the part where it's mandatory if something may impact someone's fitness to drive. So that uncertain section is the one that's most difficult, and also the one that we're trying to tease out. Because there's also a third category, which is where we have significant concern about someone's ability to operate a motor vehicle. And we do not think that even if they went to do a driving assessment, that they would be able to pass it. And in that case, it's not that we don't believe in you or don't want you to go forward with the assessment. We just want you to know that if you do that, it could cost $800. And if we can save you that money, we would like to, because we know there's a lot of expenses that come with this diagnosis. So the assessment is the on-road test. The screens are what we do in clinic. They have nothing to do with your driving history. And that's something else we wanted to be really clear about today, is that you can be someone who has a perfect driving record. We actually know a lot of people with perfect driving records, and we are not evaluating your history of driving or your conscientiousness or your value as a person or a driver. We know that you have always been a good driver. What we're evaluating is this new diagnosis of ALS or these new symptoms or the progression of symptoms that you're experiencing. Unfortunately, we also have limited ALS-specific evidence regarding fitness to drive. As most people on this call know, there's a lot of limited research with ALS right now, and it's something we're all trying to fix. But it means that we don't have a clear-cut list of if this, then the person is or isn't safe to drive. So instead, we're looking a lot at clinical reasoning when we're making these decisions. What we do know from the Canadian Medical Association is that if the condition we're looking at is progressive, the patient must be followed closely and driving must be discontinued when the disability reaches the point at which it becomes unsafe. So at Sunnybrook, what that looks like, we will ask you if you are driving. And that's because if you have made the decision to stop driving independently, we want to know. And that's something that's valuable to us. And if you're still driving, That's valuable information for us as well. All currently driving patients will be screened for physical and cognitive fitness to drive, but this is part of your standard neurological examination. We do not have a separate part of your clinic day that looks at driving specifically. In the same way that the neurologist or Maria and I look at what your arm strength means for your ability to brush your teeth or get dressed, we also look at what your arm strength means to operate a vehicle. So unfortunately, it's not a specific thing that we can point to say this is the driving test. It's the same test of strength and flexibility that you'd be asked to do regardless. Based on those results, there is a consultation with the team, and then the decision is made for those, again, 3 groups, whether someone's reported to the Ministry of Transportation, whether we continue to monitor them because we don't have concerns right now, or if someone's in that real gray area where we're not sure about their fitness to drive, we would then recommend a driving evaluation. So as I mentioned, physical screen at Sunnybrook and at most neurological clinics is the things that you're normally asked to do by your neurologist. Testing the strength in your legs, testing the strength in your arms, looking at your range of motion in your neck, looking to see if you have spasticity or weakness, looking at your breathing, and looking at your current medications. From a cognitive perspective, it's often a conversation with you and with your family or loved ones to see if you've noticed any changes in what your thinking is like. If there's any concerns, we might do a cognitive screen looking at the different brain areas that assist with driving. This is the one that most people really have trouble linking with the driving test, and we understand. Things like drawing a clock don't seem on the outside to match up with what it takes to drive a car. Please know that if we do look at cognitive screens, or if your neurologist uses a cognitive screen, they have all been validated and shown to link with the same cognitive skills you use for driving. If things look really complicated or if we're having trouble getting a clearer picture, there might be a referral to cognitive neurology for additional follow-up. If the decision is made based on the results of a driving screen to report your license, there's a couple things that happen next. So again, if your physician feels that your physical or cognitive symptoms may impact your fitness to drive, they will typically file a report with the Ministry of Transportation for your province. It's a nuance, but an important one. The doctor doesn't actually take your license. They send the information to the Ministry of Transportation and they review it and make the final determination regarding your license. It can take up to 15 business days as an individual review is performed on each case. And if it's complicated, they will bring in medical experts and ask us for more information. If their review confirms that you do not meet the medical standards to drive, you will receive a notice of suspension in the mail. I want to highlight that if you've been told by your physician in any province to stop driving, you don't wait for that official notice to come in the mail. You need to stop driving. If in the interim between when you've been told to stop and when you get the notice, you are in a collision, as Marie mentioned, you may not be covered under your insurance because you're driving against medical advice. In that middle group, if you're told that you need a driving assessment, but your license is not reported, then your physician is likely going to give you a time frame within which you need to complete the assessment. Similarly to what I just said, if you exceed the time and continue to drive, this could be considered driving against medical advice and could impact your insurance. There are a number of private clinics that offer driving assessments in Ontario, and the clinic you choose might request more information from your referring healthcare provider. Please let us know, or if your family doctor is involved, let them know. They can assist with those forms. And then I also want to talk about what happens if you're told you're okay to drive. If you're okay to drive, you can continue driving as normal, but we will continue to evaluate it every time we see you because it is a progressive illness and we need to look at how things change over time. Unfortunately, at some point, the vast majority of people living with ALS will need to discontinue driving. As with any other driver, while you are driving, you're responsible to continue to monitor your own fitness to drive on a daily basis. That's what I said about not being able to drive on allergy medication, right? If you're having a bad day, if symptoms are worse than usual, please don't get behind the wheel. And lastly, you can always reach out to your clinic team, to your neurologist, to your family physician if you have concerns between your assessments with clinic, and let them know. They can give you reassurance, or maybe they'll recognize with you that, nope, something's changed and we need to look at more detailed assessment. Okay,
what if I disagree with my physician's decision? This is obviously around reporting your license. You do have a right to appeal and disagree, obviously. That's how our system is set up, but you still cannot drive. So if your doctor has told you you can't drive and they're reporting you to the ministry, and then ministry gives you a letter throughout that whole entire time from when you're told not to drive, you cannot drive. But you can still go to a functional assessment center, even if your license was reported. That's okay. What they'll do is they'll apply for a 1-day license for the on-road test in order to do it, but you can still go even if your license is reported. So there is an approved list in Ontario on the Ministry of Transportation website. They do have to be a certified center in order to do the assessment, and then they give the results to the ministry. And the cost, as Brandon mentioned, is between $400 to $800. The assessment includes a basic vision test, physical and cognitive evaluations in clinic. So like in a, not our clinic, in their clinic, in a room. They'll do multiple different things like paper-based tests and, like peripheral vision and reaction time. And then they'll eventually take you on the road because, as we said before, that is the gold standard. If you do pass, that's wonderful, but keep in mind it's not a one-time pass. It is a progressive illness with ALS. So typically when we have our own patients that pass, on the evaluation form, there's always a section at the bottom where the evaluator will specifically write like ongoing monitoring by your neurologist is needed due to the condition of the disease. So it's not one-time pass. So keep that in mind.
Right, who does the on-road test?
It's an occupational therapist. And they're usually certified, specifically certified as a driver rehabilitation specialist.
And often there's a ministry approved driving instructor in the car as well. So you have two people keeping eyes on you from two different perspectives.
Okay. And this is a question we get in clinic quite often. What if I promise to only drive short distances? Highlighting that the highway can be quite dangerous, but neighborhoods can be more dangerous than the highway because you're driving in your neighborhood. You've got pedestrians, as you mentioned, children maybe running out onto the street, cyclists, other like older adults crossing the street. There's just there's too many things going on at once because you've got the traffic lights, the road conditions, and the pedestrians, versus where in the highway, although it can lead to greater fatalities because it's faster speeds and things like that, driving short distances is quite dangerous as well. And there's no legal process for the physician to restrict that. They can't say, okay, you can use your G on the in your neighborhood, but not on the highway. You can only drive in a 10-mile radius from your home. There's no section for that on the report. So there's really not even the infrastructure to report you that way either. Okay, there are vehicle adaptations that can help you drive again. A couple pieces of information before I go into the main ones. In Ontario, any adaptive drive control does have to be prescribed in a functional assessment center by the occupational therapist who is a certified driver rehabilitation specialist. That means that if you find it on Amazon and you buy it and install it in your own car, but it wasn't prescribed, you're in a collision, this is illegal. You cannot do this. It has to be prescribed by an OT at a functional assessment center. So myself and Brianna cannot prescribe you one in clinic either. We are not certified driving rehabilitation specialists. Keep in mind that your needs will change over time. These adaptations can become quite expensive, and you do have to consider your financial investment. There's minimal funding available in Ontario. We only have March of Dimes. I have heard of some health insurances covering it, but it's, again, minimal. It's not nearly enough to cover most of the cost. And keep in mind, if you do drive with specialized controls, your license won't let you drive a standard vehicle with standard controls. So if you are now in a rental car because in Toronto, you decide to go to Montreal or something, you can't drive with just the standard controls. You need those adaptations in your car. Okay, this is probably one of the most common ones. For your steering wheel, there are multiple. On the pictures, I put the spinning knot pins. That's the one on the left. And then on the one on the right is the knob. This essentially allows you to turn the wheel with one hand. So instead of having both hands, the hand over hand, you've got one thing and you can turn the full wheel. So if you've got weakness or spasticity in one hand, but your other hand is quite functional, this is a really good adaptation. There are also hand controls. So if you've got leg weakness or leg spasticity, decreased reaction times, all of that with your the way I keep thinking. It is possible to operate the gas and the brake with your hands. I put two examples here. The hand controls, to be honest, there are a lot of different kinds, a lot of different modifications. They can put it on the right side, left side. It could be pull, push, rock, whatever you want. There's like many different types. And that can be determined by the occupational therapist at the functional assessment center, what would work well for you. But if you're unable to use your legs, there is an option to do those functions with your hands. And a left foot accelerator, you do need your right leg to drive in most standard cars. If it's automatic transmission, there is an option to add a left foot accelerator. And then you could use one of the hand controls for the brakes as well. And then you could essentially operate the gas with your left foot. And then finally, we did mention safety with getting in and out of your car. There's lots of different adaptations for this as well. I put the three main ones. So the first picture on the top left is a transfer board. It is folded up. So it would be installed in the car. It folds down and you can transfer from a wheelchair onto the transfer board without needing to stand up. In the picture right next to it, there is a wheelchair user with a ramp. If you look inside, I should have put the picture of inside the van. If you look inside the van, there's that second row of seats isn't there. So she is able to just wheel on to the van and turn around and secure her wheelchair down. And then the final one, there are multiple different lift systems where the chair with a push of the button can turn and come out of the car. And then you're able to sit on it and it pulls you into the car as well with the push of a button. Oh, and sorry, go back. The picture is on the passenger side, but they can do it for the driver's side as well. Yeah. And then another question we get, what about my Tesla? It drives itself. Technically, your Tesla does not drive itself. They are not fully autonomous. They are testing that. It's in the research. So who knows in a couple years if we redid this webinar, what we'd be saying. But right now, it is an advanced driver assistance system. It is level 2. That Ontario took that actually from the international standards. It is rated as a level 2 system. The same driving laws apply. You have to have your eyes on the road and your hands on the wheel, and you are responsible for any traffic incident or collision that happens. So if you get into an accident with your Tesla and your hand was on the wheel, you weren't watching the road, you will be liable for it, not your Tesla. Okay, cool.
So if we end up in a situation where we're looking at not being able to drive anymore, one of the very natural next questions is, okay, then how do I do all of the things I need to do each day? Again, we recognize that things are not as easy as getting in the car on your own. We know that, but these are the resources we would suggest you look at. So family and friends, on one hand, I appreciate you not wanting to ask more of people who are already supporting you. On the other hand, this could be a very easy ask for people who have said, let me know if I can do anything. Great, take them up on that, right? And this is an easy thing, having them help you out with driving from place to place. There are also taxis and Ubers, and I understand that they are much more expensive than gas money. But when we're thinking about driving cessation, it is important to think about all of the costs that go into owning and maintaining a vehicle and insurance. If you consider all of those costs as your budget for paid services for transportation, it can make it a little bit more palatable or a little bit more possible. Public transportation in most areas, or I shouldn't say most, in urban areas is another good option. Please speak with your OT, your social worker, your ALS Canada community lead, or your family physician about this. In most cases, if your symptoms from your ALS are significant enough that you are no longer able to drive, you would qualify for accessible transportation services, which are typically door-to-door services. So if this decision is being made about your license, speak with someone who can help you complete a form for things like Wheel-Trans or Trans Help or whatever it is in your area, because you're likely to qualify for them at that point, okay? There's also something called subsidized community transportation, and this is more what we see in rural locations where different community groups will have volunteer drivers, will have a van that's available for booking on certain days, and that is often funded at least partially. So it's a decreased cost compared to having taxi for the entire day, for example. So that's something else to pay attention to. And again, speak with your team about that because we are often aware of these resources in your area. It's also worth noting if you're on ODSP funding, they are able to fund transportation to and from medical appointments. So that's something that can absolutely be a factor, and that, again, you often just need to talk to your caseworker to get the form for your physician to fill out at the appointment. And then it's also worth thinking about, okay, there's some things where you have to go somewhere and other times that things can come to you, right? So looking into meal or grocery delivery services, some of those are absolutely expensive, but there's also things like Meals on Wheels, which are subsidized services, and then in-home healthcare services. So whether that's looking at having home care services like occupational therapy or physiotherapy through Ontario Health at Home, visiting nurse at home, or some private services like physiotherapy or massage that can come to the home. Again, chat with your clinic team or your healthcare providers about that. We likely have some resources up our sleeve, and if it limits how much you are needing to go through to get out, that can sometimes be helpful as well. And then this is sort of the crux of the conversation, is what can be done right now to prepare for changes in your fitness to drive with an eye towards the future. So as I think a lot of people know, and as we know very seriously, having someone stop driving isn't nothing. And the research actually shows that it can have both practical and psychosocial consequences, and that retired drivers might be at risk of isolation, depression, or unsafe transport use. So while we do take the risks of someone continuing to drive when they are no longer safe to do so very seriously, and that is the one that we are legally mandated to report on, we also know that stopping driving isn't without consequences. And so it's really important when you're starting to have these conversations, when you're starting to think about how your symptoms might impact your fitness to drive, that you prepare for the day when you may not be able to drive in advance. So again, it's not a surprise. It's not catching you and your family off guard. I've said it, I think 50 times now, but the biggest piece is to continue to self-monitor. If you do not feel safe to drive one day, don't. You know your body better than anyone. I also think it's important to start that conversation with your family or with the people around you. What's the game plan if you're unable to drive? Who might you be able to call in for favors? What services are around? Can someone help with things like grocery shopping or getting you to the mall or getting you to church or whatever those things look like? Start to have those conversations now so it's not a million problems to solve if you're told to stop driving at some point. Also might be worthwhile starting to budget for future use of alternative transportation if that's going to be required. And then the biggest one is to start to have these conversations with your team as well. We are all on the same team here, and I know for all of us at the clinic, driving is something that we get anxious about for you and with you. We don't want to cause this change in your day-to-day life, and we are very upset with you that ALS causes this loss as well as the other ones that happen. So please connect with us early. If you're starting to have concerns, let us know. We will help to problem solve these with you where we can. So, I mean, again, I listed out chatting with OT, social work, or your ALS Canada rep about local resources, and also chat with your OT to see if things like a power scooter or a power wheelchair might help to supplement some of those short community distances. If what you need to access is a coffee shop at the end of the road, sometimes a scooter is a much easier and safer way of getting there than a vehicle. So keep us in the loop. If we can come up with problem solving like that, we're happy to do that. So that's where we've sort of ended with our formal questions, but we're also happy to answer questions that you've got on your side as well. Thank you for bearing with us through a lot of information and a lot of talking.
Thank you so much, Brianna and Murray, for that amazing presentation. I personally learned a lot. So I think we had a few questions, but I think you answered most of them in the presentation, which is great. I will ask this one question, and it kind of ties to what you just ended off on, which is driving is a huge part of independence. What strategies do you recommend to manage the emotional toll of possibly losing the ability to drive?
Yeah, and I think it's not an easy question to answer for sure. There's two elements to that. There's the practical piece and the emotional piece. So from a practical perspective, I would say those conversations early and ahead of time are some of the best ways to prepare for that loss if it's going to happen. So definitely start the problem solving early. That's the most practical approach to that concern. But then also when it comes to loss in ALS, having someone you can talk to, whether that's a community lead, whether that's a counselor, whether that's a psychotherapist, can help to process some of that on a heavier level, because it is identity shifting, it is a loss, it is incredibly serious. It's okay to take that seriously and to bring it up in those contexts as well.
Yeah, I agree. Planning is a big one. If you have a plan in place and you know what's coming and things like that, it can really lessen. It's the emotional toll is going to be there regardless because it's such a big deal, but it will definitely help to mitigate that a little.
Great, thank you. That's super helpful. Just want to do a call out to the audience. If you have any questions, please feel free to drop it in the chat or the Q&A section. So another question that was submitted beforehand, you mentioned that there isn't a lot of funding available for vehicle modification. Can you just talk a little bit about what the price ranges might be, if you have that off the top of your head?
I believe the vehicle ones were around $10,000 to $15,000, like for the ramps and the access and stuff. The I don't know off the top of my head, but I know like the steering wheel modifications are much cheaper than the hand controls because that requires installation and rigging to electric stuff in your car, which I don't know much about, but and the steering wheel ones are just clipping on. So you also have to look at how complicated the installation is. But I don't have the prices off the top of my head. It also varies based on the manufacturer and the vendor. Yeah.
Great, yeah, that's helpful. Another question we have is what kind of facility or shop should I look for to install one of those accessible chairs for the driver's seat?
Great question. So I'm gonna start all of this with chat with your OT first or chat with your physician first before you move forward with that, just to double check that it's going to be a worthwhile investment for you. There are a few different companies. So I know off the top of my head, Braun Mobility is one, Silver Cross Auto is another. They will be well advertised as companies who do accessible vehicles. So you do want to look for someone that has a high level of experience. This is not something where I would go to someone that you just know historically from down the road. You want to go to someone who has experience with accessible design and accessible modifications. Again, check with your clinic for things locally. So if you're our client, then let us know. We can point you in the GTA direction.
And the Braun Ability and Silver Cross, it's the same, like that chair I showed you, that's like a company made that product and they're installing it. So they're, depending on who you go to, that's very well versed in this, and we can help with that if you're, at our clinic. It's the same product, just different vendors that can install it, which is nice because it'll be the same.
Great, thank you. The next question we have is, can I claim the driver assessment at tax time if I choose to do one?
That is a great question.
Don't know.
I think if that's okay with you guys, let us look into that, and then maybe that can be an email response later. I don't have wrong information. And I would also say always chat with an accountant. You don't want an OT doing your taxes. I do see the argument for being a medical expense, but I also know they can be kind of sticky at the CRA about what exactly qualifies. So I don't want to give you false hope there.
Great, awesome. Yep. So for whoever asked that question, we'll follow up again with an answer, hopefully the next week or so. Great. Anyone else have any questions? Let me just quickly check the chat or Q&A. Okay, it doesn't look like we have any more questions. So if there are no questions, I just want to thank you, Bray and Brianna, for being here to share your expertise and answering all the questions that our community members have about driving in ALS. So for everyone still remaining on the webinar, there is a feedback survey that you can complete. You will be taken to the survey page once you exit out of this, the webinar, and I will drop the link to the survey in the chat as well. So please feel free to share your thoughts about the webinar and be open with your feedback. If you do have any further questions, please don't hesitate to reach out to ALS Canada, either through your community lead or through our email address, communityservices@als.ca. Again, a big thank you to our speakers, Brianna and Murray, and for all of you for joining. And I hope to see all of you at the next ALS Canada webinar. Take care, everyone. Thank you.
Thank you.